Well, thank you. I think I'm going to ask Dr. Bach, can you talk about the road to recovery model and care at St. Paul's, and maybe just, I know some of the committee members have been there. I've been there to meet with you and your team and have a visit and better understand the work that you're doing. But you could talk about your model versus the alternative, versus, status quo to the alternative that you're delivering. And also, can you talk about the gaps and opportunities in the medical education landscape within Canada and how addressing these may also help to build our workforce for physicians to respond to this crisis with quality addiction care. You got about 2 minutes. I'll give you the rest of my time on this round.
Certainly. Those are two excellent questions. I already discussed briefly the Road to Recovery model at St. Paul's, and we were very happy to host some of these members there. And once again, we're talking about a coordinated model of care where essentially the essence of it is making, there's already a question here about forced treatment or course treatment. We have not traditionally done a particularly good job in Canada at making treatment easy to access, just easy to participate in, easy to access, easy to navigate, patient-centered, flexible, coordinated. Before starting more conversations about forcing people into treatment, I would suggest that we could start by trying to make it appealing and attractive and speak to people's individual needs and goals and situations and just make treatment easy. So again, the Road to Recovery program is about coordinating a whole host of services under one umbrella so that patients can enter at different points, can move through it in ways that that speak to their particular needs and their trajectories, which are seldom linear, as we know.
Dr. Bach, sorry to interrupt. Just do you think it's almost premature to even have that conversation about mandatory treatment when people who want help can't even get it anywhere in Canada?
I would suggest yes. I would suggest that we need to be focusing on making treatment available and easy for those who are asking for it, and that's a bare minimum of this. It's the bare minimum in terms of where we can start. Moving to your second question, which I think is a really critical one and one we don't talk about enough. One of my roles is as the director of our fellowship program here, which I'm very, very privileged to sit in, and we train 10 fellows per year approximately at St. Paul's. So that's 10 addiction medicine experts per year. Unfortunately, that's about a third of the capacity for the entire country coming out of our center. We simply do not offer a lot of training opportunities for people who are really seeking, if in the medical field, who are seeking to work in this space. And so when we're talking about increasing access to all these services, we really do need to to be mindful of our workforce and really look at ways of incorporating opportunities for education for any number of different health professionals, and really making that education available. In the current climate, anyone who is seeking further training or education in this space must be able to access that. Like that is if somebody's actively wanting to do this work, it's the least we can do to try and facilitate that exposure, that training, whatever level that might be. So in order to build that workforce, because
Thank you, Dr. Bach.